You don't have to go very far in the city of Seattle to see that we have a problem with homelessness. We used to have a couple of tent cities, and now it seems that there are tents everywhere. There are RVs parked in industrial areas and in neighborhoods, people living in those RVs. It seems that our governments are spending more than ever to fight the epidemic of homelessness, and it seems like we're not getting any closer to solving it. It seems like it's getting worse. Greg Hanscomb is here today with a panel of experts to really help us understand the problem of homelessness in Seattle, what it is and what we need to do to solve it. Greg is an award-winning journalist and the editor-in-chief at Crosscut and KCTS Channel 9. He will introduce the panel, so please give a warm Rotary welcome to Greg Hanscomb and our panel. Come on up.
Thank you, everyone, for coming out. It's great to see such a good crowd. It has been almost 2 years since Mayor Ed Murray declared a state of emergency around homelessness. Dow Constantine as well, and mayors up and down the West Coast. But this is a crisis that has been going on for far longer than that. It was 1986. Under, I believe, Mayor Charlie Royer, when the first report came out finding that the services for homeless individuals in our community were overwhelmed. 31 years later, we continue to struggle with this problem. And if anything, despite all of our best efforts, despite many studies and new endeavors, the problem seems to be getting worse. At last count, the latest tally showed 11,643 individuals living without homes in King County. That is the equivalent of the population of the city of Woodinville. So we are here today to talk to a group of experts about the homeless crisis in our community, about what has been tried and what we are doing now to actually address this issue. So joining me up on stage today is, let's see, we've got three people. We have Adrian Quinn, who is the director of King County's, I gotta get this right, Department of Community and Human Services, on my left. In the middle, we've got Mark Putnam, who is the director of All Home. All Home is a coalition of county and government agencies that works to coordinate the efforts of public and private groups to address homelessness. And then we also have John Paul Yafali. John Paul is an economist. He holds 2 master's degrees, one in developmental economics, the other in philosophy. He's currently an instructor at Highline College, and he is going to talk to us a little bit about his background with homelessness. So I'd like to start this conversation, John Paul, with a little bit of your story. John Paul, you came to the United States seeking asylum from Congo. You arrived and eventually made your way to Seattle. Can you start by telling us why you chose Seattle? Why did you come here?
I'm from the Congo, and back in the country, I was a university teacher teaching at the Catholic University of the Congo, the University of Kinshasa, and different colleges. But at the same time, I was working in different capacities, especially with the UNESCO and the Electoral Institute for Sustainable Democracy in Africa. And there, we used to focus on very sensitive areas such as transparency, governance, fight against corruption. And for those who know the Congo, every time you talk about those subjects, you're gonna get in trouble. So that was the reason led me to relocate to the U.S., especially because due to increasing insecurity and the direct threat to my life. So that's why I came to the U.S.
And why did you choose Seattle?
Because when I moved to the U.S., I didn't speak any English. We speak French in the Congo. So I decided first to take a 2-month ESL class, and during that time, I had an instructor who would talk about Seattle all the time. Seattle. I have my daughter in Seattle. Then after I completed my 2-month ESL class, I was like, okay, let me check and see which city is gonna be the best. So I started checking Chicago, New York City, San Diego, and Seattle was actually the best choice because it seems like it was one of the most welcoming cities in the U.S., and also different opportunities about work, educations, and social services, and so on.
We were talking. John Paul and I were talking before this event, and when I asked him about Seattle, he gave me the full list of reasons that I moved here too. It's beautiful. It's green. There's work to be found.
Exactly.
Decent public transit system. Great
Yes.
neighborhoods. But when you arrived, you had a hard time finding work. You were living in a motel. Talk to us about the experience of running out of money and finding yourself without a home.
Came to to Seattle. First, spent a couple days in a motel, and what I could see is just I run out of money and get out of my room, start looking for a job, and it was just like, oh, you do not qualify to work in the U.S. You don't have a work authorization. Your immigration status is just we don't know what to do, and so I ended up in the streets. So didn't have any place to live, and I became homeless in Seattle.
So, and you lived without a home for a full year, right? In
Yes,
King County.
full year in the street in Seattle.
Okay, we'll come back to more of your story in a moment. Mark Putnam, can you talk to us a little bit about efforts over the years to address the homeless crisis? I'm thinking, so All Home, once upon a time, was the Committee to End Homelessness. This, as I recall, is the committee that was sort of overseeing or coordinating the 10-year plan to end homelessness in King County. Those 10 years came and went. So 2015 was the deadline, right? We were going to have this problem fixed. What are we doing wrong? How is it that we find ourselves still in this situation after so much work and so many efforts to address it?
Sure. Make sure this is on. Thank you for having me and for having this important conversation, and Adrian and John Paul for joining me here to talk about this. Homelessness is something that you pointed out that the first, I think 1986, Seattle sort of started to talk about this issue, and that date's not. It's not a coincidence that that's also around the time that at the federal level there was a deep disinvestment in affordable housing production and funding, a steep decline if you look at a graph of where we were then to where we are today. And in the mid-2000s, under President Bush, there was an effort across the country in cities and each major city across the country to do a 10-year plan to end homelessness. And the intentions there were to set a target date, to set a goal, to galvanize support, to bring together community from all different sectors to address a seemingly intractable problem. And the goals here in this community, and Adrian and I were involved in the plan in different roles at the time, but were to house the 9,500 people that they estimated that need to house over that period of time. And they house that many and many more. It was almost 4,000 people per year, actually, that moved from homelessness to housing, so about 40,000 people. And I think it's an issue that we're still facing today, where we're seeing that increase. We've now gone from about 4,000 a year to about 7,500 a year that we're people who are homeless that are being able to move out and get housed, and they use nonprofits and all the partners in the community. They use their own self-resilience that I'm sure John Paul will talk about. And more people are becoming homeless every day, and a deep cause of that is that lack of affordable housing that we have, that we continue to have in our community, and perhaps is the top issue that needs to be addressed here.
Got it. Adrian, do you want to chime in here a little bit on efforts that are currently underway to address homelessness in the county?
Sure, and thank you for making this time to have this conversation as well. I wanted to also elaborate on some of what Mark said. There's a lot of focus right now saying on why is the homeless system not working? And we hope that we can broaden that conversation, because in fact the homeless crisis system is really on steroids right now. So for example, in 2016, at the point in time count, there was just over 10,000 people who were homeless. And the homeless crisis system housed 15,000 people. And so that system is increasing and working and working. And what is not happening is sufficient foci on the root causes. So in addition to deep disinvestment in affordable housing by the federal government, there is also, at the same time, a deep disinvestment in mental health and substance use. There is closure of many facilities, and right now the streets are functioning as are mental institutions. And so one of the things that the county has been working very heavily on is trying to increase the number of facilities that are available, both in terms of substance use disorder and mental health as well. And so opening in October, there's going to be a new detox facility, an inpatient facility in Beacon Hill, a new mental health inpatient facility in Federal Way, a new secure detox in Kent. And the county is using primarily local funds, so the mental illness and drug dependency tax, the Veterans, Seniors, and Human Services levy, but that money is not sufficient, and the county is only one player in that arena. And so we continue to invest in those areas, but as Mark said, the number of people becoming homeless are just increasing dramatically, and the largest reason for that is housing displacement. One of the areas that we're going to be trying to address, and I have to be careful because we have a ballot initiative coming up, and so I have to be very factual, but for the Veterans, Seniors, and Human Services levy is a shallow rent subsidy for seniors. We hear from many seniors, they are on a fixed income, but the rent keeps going up, and so they are facing choices of not being able to pay rent. Many are trying to move to cheaper areas, but we are running out of cheaper apartments and cheaper areas within this region.
So we have a sort of a handful of different issues that kind of collide here, right? And I guess my question, for both of you to start is, how much of this is a problem of simple sort of supply and demand versus how much is a problem of these kind of core root issues such as mental health treatment, addiction treatment, that sort of thing? How much of this is just we don't have enough housing, and how much is we're really just not looking out for people?
I'd say it's both. It's absolutely both. I mean, so in places like West Virginia, where the opioid addiction issue is far worse than it is here, housing's really cheap. And so people are still in their homes, but they were able to buy those homes for $10,000, when they were still working. People here don't have those, they get displaced as soon as they have lost income or sufficient income.
John Paul, tell us about how you finally found your way back into housing at the end of that long year.
Yeah, being homeless for the first time has been a huge frustration. I was there and, didn't know what next. I was kind of lost. Then I was like, observing other homeless, I was like, I might have something to change in this situation. So to me, it was like everything changes, new land, new situation, but I will still have the same passion, the passion to providing services to the community. That was kind of a motivation for me to get back on track. And so I start, as homeless, providing services to the community, teaching community classes, safety classes, and disaster classes at the American Red Cross. Also.
So you were living on the streets and
Yeah.
teaching classes for the American Red Cross.
Exactly, and people didn't even know that I was homeless, but I was there and that's resulted to a situation. I saw somebody having stroke and people around didn't know what to do. So he was taking too much drugs and so on. So I helped with the situation, and I was like, you guys don't know how to respond to an emergency. They say, we don't know anything. So that was the motivation to me.
And eventually you did find work.
Yes, after 15 months, then I got my work authorization from USCIS, then looked for a job, and I was able to get one. And to then move to housing and secure it up to now.
Got it. Mark, question for you about, there has been a shift in policy recently toward, well, a couple of shifts in policy, major shifts. One of them is toward something more of a housing first model, where let's get people into housing as quickly as possible, subsidize their rent, let them get back on their feet. There's also been a new movement, at least with the city of Seattle, to use more sort of data-driven methods. Let's see what works. Let's see what the costs are and the benefits are. Where do you see the progress or the potential for some of these new strategies to sort of pay off?
Sure. Adrian and I both spoke to the number of people that are moving from homelessness to housing. 7,500 households, or 15,000 people total in those households last year, and we're seeing that increase in a lot of ways because of shifting programming toward best practices and providers really innovating, funders really rewarding that innovation and rewarding programs that are working. The city and the county and the United Way of King County have committed to using data to drive that decision making. The county's been, and Adrian can speak to this, but has been using data in its funding decisions for a while now, and the city will be doing that with its current funding as well. Those are things that we're already seeing the impact of that, because we really made those shifts a few years ago. There's some bigger pieces happening right now. What it means, though, is that what we're trying to do is, with limited resources, house as many people as we can, and I think we've shown that we can house more people with the resources we have, but that the number of people becoming homeless continues to grow, and I think it does point us back toward these root causes of lack of affordable housing and inadequate funding for behavioral health.
I want to open it up to questions from the audience in just a minute, but John Paul, question for you. Had you been able to get into housing quickly when you first found, if you had, when you first found yourself living on the streets, how much of a difference would that have made for you to just have a home base?
Yeah, in the street, just think about how would you feel if you can even make your own coffee? Think when you cannot even watch a game, or you make your own popcorn. So it's really hard being in the street. You can't do anything. You can't even focus. You can't even do anything. But when I moved into housing, I was like, okay, now I'm gonna get back to myself. Then I start helping other people with my own resources, even out of pocket. I actually help households to secure their housing with a little rental assistance. So because I don't want people to go into the street, and especially that's exactly also what I'm learning from All Home, and I thank Mark for having me in his team. We need to keep people housed, and we need to help people move into housing so that they can be themselves and focus in real life.
One question for Adrian before we turn it over to the floor, and that is, how does Ed Murray's resignation as mayor impact the current direction on homelessness and progress for the coming months?
So I think it's yet to be seen. I would say from the county human services perspective, we have a very good partnership with the city human services department, and one of the key things that they've been working on right now is competitively bidding out all of their homeless money. It has not happened in decades, and there is a lot of pressure in the community for there not to be outcomes focus in that. And so I think that there's a question about will that RFP still stand? Will it still be outcomes focused if there is not this particular mayor who was pushing that issue?
So things kind of hanging in the balance. Let's open it to questions from the floor.
Hi. Thank you for being here today and speaking on this very important topic. What I'd like to ask is what is being done or planned to be done to improve dramatically the mental health services in our state? Thank you.
Thanks. In 2014, the federal government did a overview of funding for mental health services across the country. And Washington State was 50th in terms of funding for mental health. And so there should not be a question about why people are not able to obtain mental health services. I'd say since that study came out, Washington State has dramatically increased what is being funded for mental health. Certainly the county has continued to try to increase, but it's still very insufficient for what the need is, and does not allow people to have the access to services that they need, both for substance use and mental health.
For our centennial, our club supported a project in homelessness to address the root causes of homelessness. We focused on children, hoping to get them out of the cycle so that they would not perpetuate the lives of their parents. You haven't mentioned children. Could you address that, please?
Sure, I can speak to that. Maybe John Paul could as well. There's a lot of effort happening around family homelessness, and I think we're seeing some progress there as well in the number of families that are being housed. We've had strong efforts from the city and the county, and the federal government has set some real clear targets around ending family homelessness. Locally, what's working, and you mentioned before some of the best practices and new policies, are things like getting people as quickly as possible into housing. In order to do that in a community like ours, where it takes a few months really to find a place to rent, with the scarcity of units, is we do need shelter. And so there's been an expansion of family shelters. The county has opened shelters recently in White Center, and I think will soon open in Kenmore. So there's a number of options. And these shelters, are available throughout the day. That's a really important thing, I think, for people that are experiencing homelessness, that they have a home base. If you have a home base, you can leave your things there. You can get mail there, and you can leave your things there while you look for a job or while you bring your kids to school. It's obviously important to have a home, but the shelter provides that transitionary place for people to be. So housing and getting folks off the street, particularly children, is really important. I'd just add one thing is that we're seeing a real rise in the number of homeless school kids across the state that are experiencing homelessness, and also here in the Seattle School District and in school districts across the county. And that's a deep concern. There's some innovative new partnerships to identify kids that might be unstably housed in schools and connect them to housing and services before they lose their housing. Those efforts are really important as well.
And am I correct in thinking that the county still does have a goal to end childhood homelessness by a certain year?
Yeah, there's a national, the U.S. Interagency Council on Homelessness has a plan to end family homelessness by 2020. And when we say end, what we mean is if somebody does become homeless, that we have a quick response, that we have a place for them to be very quickly. And so that remains our aim, and we're frustrated by the number of folks coming in that we're seeing become homeless. We are encouraged by the number of people we're housing, and we think with more resources we can meet those goals.
So you've mentioned transitioning from 4,000 a year placed to over 15,000 a year placed. Can you speak a little bit about the average time for someone to be homeless and how that average time has changed over the last decade?
I could speak to that. I was just looking yesterday specifically around family homelessness. 3 years ago, the average amount of time a family was experiencing homelessness in King County was about 370 days, so a little bit more than a year. It's now about half that, about 180 days. And if somebody's in shelter or a temporary housing situation, they would still, those days would count toward that. It's still too long, and our goal is to continue to improve that by at least 10% a year, keep moving those numbers down. We want to get to about 90 days and then to 30 days and keep chipping away at that. And we're encouraged in that we've seen communities that do have enough affordable housing that have gotten closer to those goals.
It is clearly a major problem that we have here, and we've done an awful lot in the last few years in doing studies. We had a study that was commissioned both by United Way, the City of Seattle, and King County in September of last year. And I'd like to know exactly what we're doing right now. How far along have we gotten in this performance study that the Focus Strategies did? Because you're talking about data-driven situations. We really need to start pushing ourselves in the direction of that data and in one direction to try and get those homeless populations dealt with in a reasonable and efficient way, which we have not done in the past.
A couple of comments about that. So as Mark mentioned, King County is using that data right now and focusing on issues like, and a very good example is yesterday we've been working with organizations on shelter utilization, meaning if you're being funded for a shelter, is the shelter full? Are people able to exit the shelter into long-term housing? And so what the county has been doing is if an agency is not meeting its goals, they're not being paid. And so this is something that we look at a frequent basis. Both All Home and county and city staff have been providing technical assistance to agencies to try to improve that performance, but fundamentally, if you're not providing the service, you're not getting paid. It has dramatically increased shelter utilization. My comment earlier about the city's RFP is critically important. That RFP contains those outcomes, and if the city contracts don't have outcomes in it, as one of the largest funders, then that data is actually not going to be used. And so the system performance is just one facet of it. We can only squeeze so much out of the existing resources. We clearly need more resources in this community and a broader community effort too. It can't just be a couple of governmental entities, a couple of really fantastic nonprofits, but it really needs to be a much broader community effort.
Okay, we've got time for one more question from the audience.
For almost 2 decades, I've had the privilege of counseling and mentoring international graduate students that come to UW, and I often ask them what surprised them most on their first arrival in the United States. And almost without question, they say, homeless people. We can't believe there's homeless people. We don't have any homeless people in our country. Don't these people have families? That's the thing they say. And it prompts me to ask you, are there programs like family counseling, early childhood education, other things that address these sort of early systemic things, not the proximate causes that you addressed earlier, that homeless advocates support at the state and federal level?
Okay, homelessness is real. I'm an example of, being homeless here. And also, Mark talked about the count, even Adrian. I've been counting people in the street. And so homelessness is real here. And if there is somebody who will say like, oh, he doesn't believe, maybe he just have to go in the street and he will realize that it's true. We are facing homelessness.
And I just quickly add that Best Starts for Kids, which is a county initiative, has a homeless prevention element of it, and it's also focused on some of the underlying issues for trauma, children who have experienced trauma, to try to reduce that. We have also rolled out now in every middle school within King County. There's a planning grant right now to have screening, brief intervention, and referral to treatment for mental health and substance use too, if that's warranted.
Okay, we've got time for one last round for the three of you, and I've got a question that I'd like each of you to address. You've got a minute each, and that is, talk to me about one myth about homelessness, one misperception or misunderstanding that people have about homelessness, the crisis, people living in homelessness, and tell me why it's wrong. John Paul, do you want to start?
Yeah, I would say one myth. People say that people who are homeless do not work. And to me, that is not true. I will go with my own example. I've been homeless but providing services, teaching at the American Red Cross, preparing tax returns for low income, serving in different capacities with Municipal League of King County, with field investigations about elections. But if I can talk about data, data shows that 30% of homeless people are actually working, and another 20% have not worked within last year. And also 30% of those people became homeless when they lost their job. And we have everything that we can provide around that.
Mark?
I guess the myth I would share is that people are moving here to Seattle as homeless, and they're coming here for our services. I think Jean Paul and Greg spoke about sort of the reasons why you'd come to Seattle. I think those are valid. I could back that up with some statistics. We've been asked this question for years, and so this year we asked, I think, a better way of, during our one-night count, we asked people during surveys and follow-up where they were last in housing, and nearly 80% were last in housing here in King County, and another 15% from just around King County and Pierce and Snohomish counties. And another way of asking that is, what was your housing situation? And fully 80% as well were renting or owning or living with a roommate or friends or family when they became homeless.
Adrian?
The myth I'd like to dispel is that homelessness is a lifestyle choice. Let me provide two examples. There are many women experiencing domestic violence. They don't have a lot of money, or in some cases the abuser has restricted access to money, and so their choice is either to stay with the abuser or to take their kids and live in the car. That is really a a horrible situation. And so the choice is to leave the abuser. The choice is not to become homeless. A second example I'd provide is we recently worked with Harborview Hospital for a gentleman who had been homeless and he was now dying of cancer. We could not get him into medical respite because he had a criminal conviction from the 1970s. He had lived on the streets and was now dying on the streets. It was because of a criminal conviction from the 70s that he was homeless, not a choice.
Adrian, Mark, John Paul, tough truths. Thank you so much for joining us. Really appreciate it, and thank you all for coming. Can you stay up here for 1 second?
Thank you, Greg and panel. I have to ask you one more question, Adrian. If we keep doing what we're doing now, will we solve homelessness in King County?
No.
What do we need to do to solve it?
The analogy that I'd like to give is, people don't say to my counterpart in Department of Natural Resources, Chrissy, what are you going to do to end global climate change? And the reason for that is because everybody recognizes that there are multiple inputs and multiple solutions. I think Mark stated that in the beginning about homelessness. That's exactly right. All of us need to figure out what we as a community can do. I mean, just a couple of simple things. We talked about lack of housing stock. We've got tons of people in our community that are renting their places on Airbnb, VRBO, things like that, whole condo buildings being rented like that. How can some of those folks convert some of that housing to housing for people like Jean Paul?
Well, maybe we need an Airbnb for homeless people. Adrian, thank you so much. And Greg, thank you. Mark, Adrian, John Paul, thank you so much. Really good conversation today.